Heartland Alliance's philosophy of care is core to everything that we do. It is our guide to how we deliver services. It is the foundation on which our values as an organization are expressed. Heartland Alliance's philosophy of care is comprised of 5 principal elements. Number 1, a human rights foundation to everything that we do. Number 2, an investment in strength-based assessments and interventions. Number 3, a harm reduction approach. Number 4 is a trauma-informed perspective to our work. And number 5 is inviting, recognizing, and embracing differences and the value they bring to all of our lives.
It is not a legal document. It is not a political statement or a set of articles that we need to follow. It is about working with individuals to ensure dignity and respect and reduce humiliation.
We had a senior gentleman on our caseload who was trying to get moved from one development to the other, but when he applied, he had an extensive background from criminal activity from his younger days that prohibited him. So we met with him, allowed him to tell us what had happened without judging, gave him some advice, referred him to the Legal Aid Foundation, who actually helped him work through the expungement and the sealing process. All of his charges were sealed, and now he's able to move into a new unit.
It is not about telling someone how strong they are for the experiences that they have endured. It is about using these experiences as strengths, as an opportunity for them to move towards chosen goals.
At Heartland Health Outreach, I work with a client who is a recent refugee. He was trying to get access to a certain HIV medication that Illinois Medicaid would not cover. So we at the clinic assumed that we would have to walk him through the process, but we found out in the end that his strength is advocating for himself.
There's a misconception that we are enabling or condoning a participant's harmful behavior. But it is about working with our participants and allowing them to take the necessary steps to stay safe.
Las personas en ocasiones viven situaciones que le generan tristeza, dolor, llanto, y que esto permite que se alejen de otras personas. Es importante que las personas asistan a estos servicios, ya que se sienten escuchadas, sienten que su vida vale de algo, sienten que nos van a ser criticadas.
It is not about being afraid of working with participants because of the traumatic experiences that they've been through and the potential for re-traumatizing them. It is about working with our participants to understand how we can best provide services and understand that the responses that our participants have might be a reflection of the traumatic experiences that they've been through.
When my client will do some behavior that makes me really frustrated, and I'll understand that if a client calls me 8 times in one day, it's because they're anxious about something, they're nervous about something, and it's a sign of an underlying trauma that might be resurfacing. So I need to be particularly attuned to that.
It is not only about recognizing that differences exist. It is about inclusion of these differences and embracing these differences.
When we were faced with providing email access to our international community, we decided to talk through with what their challenges were and also kind of talk about what experiences our internal team had had when dealing with these types of issues. When we put all these ideas together, we were able to come up with a solution that brought that international community closer to the domestic-based employees.
As president of Heartland Alliance, I take great pride in the fact that we have a philosophy of care. It is part of what sets us apart. Each one of us, as a team, is engaged in using the philosophy of care as we serve people.